Hello. In this episode of Psychiatry in 5 Minutes, we're going to talk about schizophrenia. I think schizophrenia is best thought of as a disorder where your brain gets put together bad. Now, the question is, what could cause your brain to be put together poorly? Genetics can certainly cause it. Anything in neurodevelopment, meaning viruses or toxoplasmosis affecting the developing brain in utero or maybe shortly after birth, can cause it. In addition to that, brain injury leads to a higher prevalence of schizophrenia, and you will see brain changes, of course, with that, especially in the left temporal area. In schizophrenia, neurochemically, we think there is an excess of dopamine and an excess of glutamate. The medications that we use primarily address dopamine to try to reduce that. As time passes, there is a general decline in someone's ability. Early on in the disease, positive symptoms, things that are there in addition to what should be there, hallucinations, delusions, agitation, are prominent. But as time goes on, negative symptoms, meaning things that should be there but aren't, become more prominent. So someone has less initiative, less energy, less social skills, less get up and go. Now, in terms of medications, the central theory, at least so far for medications, has been that they block dopamine. And the whole array of the older medications, haloperidol, chlorpromazine, were important. The newer medications, which are now decades old, also we think affect decreasing dopamine, but also can affect serotonin. And the hope was they would be better for negative symptoms. It hasn't really panned out. The pill that's the most useful, most effective is Clozapine. Clozapine is always a test question answer. 1% chance of agranulocytosis, 5% chance of seizures, and in general works better than any other antipsychotic. The best way to think of the other antipsychotics is to divide them on a fulcrum. On one side, Clozapine, olanzapine, quetiapine. The pines, think P-I-N-E, pining for food, and because of the antihistaminic properties, there is increased weight, increased cholesterol, increased lipids. On the other side, risperidone, ziprasidone don't have as much weight gain. However, they have more extrapyramidal symptoms, meaning shakiness as well as akathisia, ants in your pants running around, and akinesia, or slow movements. Aripiprazole fits in there too, and it famously has a lot of akathisia. Tardive dyskinesia is a side effect of all of the medications, and we think it comes from hypersensitivity to dopamine over time, that the blockade over time leads to hypersensitivity to whatever dopamine comes through and leads to an increase in movements, in all muscle movements. There are 2 FDA-approved drugs to treat this, deutetrabenazine and valbenazine, and we think that they work by inhibiting dopamine transport in the cell. In addition to that, remember, in addition to the pills, there are injections of antipsychotics that can last anywhere from 2 weeks to 4 weeks. And some people believe that they may be more effective as time goes on. In terms of other test questions, ziprasidone has a bit more problems with QT interval problems than other pills. But remember, for all of them, before you begin and every few months thereafter, you should check hemoglobin A1C and the lipid profile to make sure glucose and lipids are not getting out of control. In pregnancy, antipsychotics are relatively safe. Remember, there's no absolutely safe drug, but antipsychotics are relatively safe. Other drugs in pregnancy, by the way, the antidepressants, fairly safe, except for Paxil has been associated with pulmonary hypertension. Benzodiazepine is fairly safe. Lithium is not all that safe, associated with Epstein's anomaly or tricuspid valve malformation in about 5%. Anticonvulsants can lead to neural tube deficits in about 8%. Now, 2 other disorders related to schizophrenia you should be aware of. Delusional disorder is a disorder where someone primarily has delusions or fixed false beliefs. Hallucinations, if present, are not prominent. And the problem is that these folks don't always respond as well to antipsychotics. We can try, and we do try, they don't always work so well. Paranoid is most common, or what's called persecutory delusional disorder. Jealous factors can be important, and you can see people who have somatic delusions, that they're infested by parasites, or somatic delusional disorder. The second one is schizoaffective disorder, and it's best thought of schizoaffective disorder as kind of a combination of bipolar disorder and schizophrenia. By definition, somebody has to be psychotic for at least 2 weeks without mood symptoms, but the mood symptoms, while they come and go, are prominent in the disorder, and you can have either bipolar type schizoaffective disorder or depressed type schizoaffective disorder. So anyhow, I hope that is helpful. Schizophrenia affects 1% of the world's population. It's an enormous public health problem, and people with schizophrenia have a decreased lifespan of 20% compared to the general population. Almost everybody with schizophrenia smokes, and they die of cardiac and pulmonary effects primarily, although suicide rates are indeed increased. Thank you, and again, read more about this.